Three.
Hi, I'm Courtney. I'm a Davenport University student, nursing.
Hi, I'm Angie. I'm a Davenport student for nursing.
Hi, I'm Melina. I'm also a Davenport University student, and we are working on our mental health video.
Hello, my name is Hussein. Hello, Melina. I'm Hussein. I'm a Davenport student, and how are you guys doing today?
Good.
I'm doing good.
Good. Who do you have with you here today?
I have my mom.
Hi, my name's Angie.
I need to get your weight and height. If you could please step on the scale for me, please.
Okay.
All right, perfect. Can you have a seat for me so I can check your vitals? It is really important to get your baseline information for the doctor so he can evaluate you.
Okay.
Okay. Let's check our vitals. Everything looks good. What brings you in here today?
My mom thinks I have a problem.
Yes, I've been concerned she has ADHD. The school and her family physician has brought it to my attention. They've asked us to come and get her tested, maybe get her some medication, some therapy.
Okay. Have you ever had any medical workup done with your physician to rule out this cause?
Yes, we did. That's when the doctor referred us to you, and we've already filled out the questionnaire that your office sent to us, and
Okay.
we've given it to the front desk.
Sure. Okay, thank you for that information. The doctor is gonna go look over it right now and evaluate and look at the test to see what kind of diagnosis is appropriate for Melina.
Okay.
Can you describe the symptoms she's having right now?
Yes, we've had to ask her several times to finish any task. She can't seem to stay focused to get anything done. She spends all night doing her homework. She just gets sidetracked all the time.
Hey, Mom, look
We
at
try-
this thing.
Melina, could you please put that down? Melina.
Okay. Well,
With the
let's just
doctors.
focus
Thank
here
you.
right now.
So even to play a game, we can't keep her focused. We have to keep telling her when it's her turn. People get frustrated, they give up. I know it's been just so stressful, and I know Melina's getting frustrated as well. And to even keep her focused in a conversation, we have to keep her to make eye contact
Okay.
to keep her on track.
Just jotting those down right now so the doctor can take a look at it. Melina, do you feel that you have a hard time holding conversation and activities around people?
Yeah, I feel like I do. I'm always wandering, and I never know what's going on. I don't pay attention in class because there's always something fun going outside the window. There's squirrels and birds, you know.
Yeah,
Cool.
that can be really hard for you. Do you feel organized?
No, not at all.
Okay. I have noticed since you've been here, you've been out of your seat and you've fidgeted a lot and you're nervous. Is this a usual behavior?
I mean, yeah, you're someone new. I don't know you, and I don't like being here.
Okay. Well, that's fair enough.
I've had to attend many teacher conferences for Melina to address her disruptive behaviors in class. She's got a long history, fidgeting, talking out of turn, getting out of her seat. I used to think it was a discipline problem, but the teachers have brought it to my attention. It's not something she's really been able to control as much as she's tried. So that's why we're here. We're hopeful that there's a solution to getting her on track.
Yes, absolutely. You are in the right place. The doctor will help Melina and you will work together step by step to figure out what's going on with Melina and the right diagnosis, and we're by her side.
Okay, thank you.
Hi, my name's Courtney. I'm the doctor. How are you guys doing today?
Good. How are you?
I'm good. You must be Melina.
Yeah.
Is this your mom that's with
Yeah. Yep, I'm Mom. You can just call me Angie.
you? Okay. Hi, Angie. It's nice to meet you.
Nice to meet you.
After careful review of your records, that I got from your family physician, and the questionnaire that we sent out to you guys that you had filled out, we are sure that Melina is suffering from some ADHD. But the good news is that we can definitely help and get things situated for you guys, okay?
That is so wonderful. Thank you.
Melina has showed some major inattentiveness, especially while she's been here today. She seems like she's having a hard time focusing and staying on task. Her attention is not held very well when it comes to like activities and conversations and things like that. And that can definitely interfere with her learning abilities, which could show a decline in like her grades at school. So if you guys have seen any of that, it could be due to the ADHD. It can also include some impulsive behavior because of the distractions. She might have a hard time talking out of turn in class or getting out of her seat often. There is a lot of hyperactivity involved, and like things like squirming and fidgeting might be a problem. The disorganization that Melina has presented is part of the ADHD, so please don't be discouraged. As a team, we can definitely get everything back in track.
Well, thank you. For the first time, I feel very hopeful.
Okay, so I also wanted to point out something else. As a result of the ADHD, there are a couple comorbid conditions like anxiety and depression, but don't worry, that's all treatable.
So what if I get these things?
I'm recommending a combination of medication therapy and behavioral therapy to help out with those things.
Okay, can you explain the medication options?
There are a few medication options that are available. The ones that are mostly used are stimulants, and they come in a short-acting form or long-acting. The long-acting is more recommended because people often forget to take the medications, and this reduces. There are a few options available. The most commonly used ones are stimulants, and they come in a short or long-acting form. Usually the long-acting ones are more recommended because people often forget to take their medication, and this reduces those errors and promotes adherence. And this is the one I'll be recommending for you, Melina. It's called Adderall. The short-acting ones you would need to take 2 to 3 times a day, and I think that would be too much for her schedule right now. The other form would be a non-stimulant, which is not a first choice because some side effects could be suicidal ideations.
Can you explain the therapy part to me?
I will be providing a referral to a psychologist twice a week for an hour. They'll help you set goals. Therapists can teach you some control in the behaviors that you're implicating, and it'll help you address your emotions. Melina will be able to cope better through her therapy and learn organization skills and keep journals to help better equip her.
How long do I have to go to this therapy thing? Because I'm very busy.
Treatment is generally lifelong, and I will continue to monitor you throughout your treatment. As changes occur, treatments will be adjusted accordingly to your needs. Before we start medication treatment, I'm going to send Melina to get an EKG done of her heart, just to make sure that everything is good with that, because it is a stimulant medication, and it can cause death in people with heart conditions. If there's no more questions for me, I'll send my nurse back in to go over some education on your medication regimen.
Okay, well, thank you,
Thanks.
doctor. We'll address any further questions we have with the nurse.
Okay.
Hello.
Hi again.
So it looks like the doctor went over everything, and he's going to prescribe you some Adderall for you, Melina. I'm here to answer any educational or any concerns you guys have on that specific medication.
Okay. Do you know what time I should be taking the medication?
So let's start first. You'll be starting on long-acting. It's 10 milligrams by mouth, and we will increase it if it's needed.
Okay.
And you'll be taking this in the morning. Not at night, because you will have a hard time sleeping at night, and let's call it insomnia. And we don't want you to be taking it, you know, in the afternoon or at night. So start taking it in the morning.
Can I take it twice a day? Because, you know, sometimes I forget things in the afternoon. Is that
We will have to talk to the doctor about it, but first we're gonna start you in the morning and make sure not to chew it, just swallow it, because it's long acting.
okay?
So what if I want to take her off from it during the summer?
This is what they call drug holiday, and I advise not going that way, because the purpose of the long-acting drug is to build the bloodstream and then wear off slowly. This minimizes the ups and downs caused by fluctuating medication level and cause less a rebound effect, where symptoms return often worse than before as the drug wears off.
Okay, so what are the withdrawal effects?
Some side effects of withdrawals are fatigue, depression, headaches. She'll feel a little bit anxious. So what do you think, Melina? Is that fair enough?
Yeah, but I kind of want to be off of it for the summer. I don't
Okay.
want to take it in the summer.
Well, Melina, we'll discuss that.
But summer is so much fun, and I can stay up all the time.
Melina, we'll discuss it. We'll have time to discuss this.
All right. Now we're going to talk about your lifestyle adjustment, Melina. Is that fine? Because you
Do
have
I still get to eat
follow-
pizza all the time? 'Cause-
You can eat whatever you want.
okay.
So, but exercise is very important to your treatment. It will boost your brain dopamine and norepinephrine and serotonin level, which affect focus and attention. You will want to make sure you're eating healthy and adding more omega-3 fatty acids to your diet.
So does my pizza have to be healthy?
Well, you
Actually, I
can
think
eat-
pizza is kind of healthy.
Yeah, pizza's good. And you gotta make sure you get a good night's sleep so your body can have the best energy the next day, so you'll feel refreshed.
Okay.
Do you have any questions?
Well, can you give me any more information? It seems like a lot of people are on this Adderall.
Yeah. Yes, you're right. Adderall is commonly used to treat ADHD and often abused. So make sure you're monitoring your child's usage carefully, because the reason of this medication is to it's not an unlimited refill, so you have to come to your appointment every month and follow your therapy so we can evaluate her and see if we want to upper the dose or keep the dose, so she has to come to her monthly appointments.
Okay. All right, so what are the side effects of the stimulant?
So, I mean, the most important thing is to monitor Melina's weight, because of the side effect. It cuts the appetite down, so she might lose some weight. And what I have here is
So that's probably why we need to monitor her weight.
her weight. Yeah, it's really
Make sure
important.
she's eating well.
Yeah, make sure
I
she's
always
eating.
eat. It's okay.
All right.
But I think, Melina, what he's saying is that the stimulant medication is going to make you not have so much of an appetite.
Yeah, so make sure you keep a healthy snack when you go to school at all time, like granola bars, yogurt, bananas. So
Okay.
you can replace, that can help.
Well, thanks for bringing that to my attention. I'll monitor her diet and things like that to make
Sure.
sure she's staying on track. And is there anything else you suggest for Melina?
Well, there's a couple more side effects that I want to talk about. So we said a decreased appetite, insomnia, but this might happen early in the treatment and usually mid and short between like her treatment. So it might happen earlier, it might happen, depends on her body weight, her size, how she's reacting to the medication. We talked about the fast heartbeat, the headaches, dry mouth, blurred vision, diarrhea. And we, of course, we will send her home with some important information so you guys can take a look at it, educate yourself before taking the medication. And of course, if you have any question, you can call the office anytime.
Yeah, definitely. We'll definitely take them handouts, and I'll have Melina go through them with me, because I know she's pretty sidetracked here. Maybe once we can make sure she understands the side effects.
Sure. Do you have any more questions for us?
No, I think I'm good for now.
Okay, well, it was very nice meeting you. Please stop by the front desk so you can make your appointment for your EKG and your next follow-up appointment, and make sure I will send your script to your local pharmacy. Thank you guys.
All right, thank you.
Okay.